Well, welcome back again, everybody. My name is Jackie, and I am a nurse here at UWorld. We're so glad to have you guys on today. We're going to be doing something a little bit different than what we typically have been doing with our kind of like disease process content. We're going to just walk through 4 SATA, or otherwise known as Select All That Apply or multiple response questions today. We're going to talk about different strategies to approach them and just give you some tips and tricks because you'll definitely see them on your NCLEX and you'll definitely see them in nursing school. So we're going to help you guys with some of those strategies and get started. But again, we'll do 4 questions together. We'll talk about how to approach the question, and then we'll also talk kind of high level about the content in them too, so it'll help you answer the questions. But just a reminder on our schedule, we are available, or we are on live every Tuesday and Thursday on your favorite social media channel. You can find us on demand on Facebook and YouTube. And for everyone on TikTok, I want you guys to share this live right now with all your friends. We want everyone to be able to join. So go ahead and share it or share it along the way. But we hope you'll invite other nursing students to join us. Let's see. I think we've kind of covered all of our little housekeeping things. I think we're probably about ready to get started. But as we always say, just drop your comments in the chat. Anything you want to hear, you want to see, let us know how we're doing. But we'll go ahead and jump in and get started. Okay, so again, their topic of conversation today is all about Select All That Apply questions. So what are SATA questions? That's what we call them for short. So they're also called multiple responses because we're going to have more than one right answer. We don't know how many SATA questions you're going to have on your NCLEX, but you'll definitely see them, and you'll see several of them. So we want to make sure you guys are equipped to answer them. You're going to know that these questions are Select All That Apply or multiple response because in the question itself, at the end, it's going to be bolded and it's going to be Select All That Apply. So any of those key words that you see in a question that are bolded, they're bolded for a reason. The test makers want you to see them and want you to know that it's keying you into something a little bit out of the ordinary. One note, too, to make about SATA questions is how they're scored. So they are scored with a plus-minus scoring system. And this is maybe a little bit different now that we've transitioned to next-gen NCLEX. But how plus-minus works essentially is you're going to get a point for a right answer. You're going to lose a point for a wrong answer. And then if it's not selected, you're not going to gain or lose a point. So you can find all of this information out also on NCLEX.com. They have information about scoring rules in there. But for all of these questions, we're going to kind of take just like a 3-step approach to them. And I hope you guys can kind of get used to this as we go through our 4 questions and just get used to kind of looking at what the question is asking. So first, we're going to look at the STEM, which is essentially kind of like the intro to the question itself. And we're going to see what our topic is. So we're going to kind of hone in on exactly what things we need to be thinking about. Then we're going to look at what the question is really asking. If we're looking for like a true false answer, if we're looking for appropriate, not appropriate, different things like that. Or if we have a negatively phrased one, we have to totally flop our understanding of how we would approach a question and keep that in our mind too. And then lastly, we're going to look at the options just one at a time. We're going to let them be like a standalone, and sometimes I have to read them more than one time, but we're just going to take everything one step at a time and not rush and not look for certain things. Just read it as it is. All right, so let's jump in. We're going to pull up our first question. So again, this is our first of 4 questions for anyone that's just joining. We're talking about SATA questions, and we're just going to walk through them with an approach to strategy and then also some high-level learning about the topics themselves. Okay. So I'll read the question. I'll give you guys a little bit of time to answer it, and then we will go ahead and walk through it. Okay, so the nurse is preparing to irrigate the wound of a 7-year-old client who sustained a laceration while on a playground. Which of the following actions should the nurse take? Select all that apply. So option 1, review the client's vaccination record. Option 2, obtain a 10 milliliter syringe and a 27 gauge needle. Option 3, administer an analgesic 30 minutes before irrigating the wound. Option 4, cleanse the wound from the most contaminated to the least contaminated area. And then option 5, use continuous pressure to flush the wound and repeat again until the drainage is clear. All right, so you guys take some time. Go ahead and put your answers in the chat, and we will see what we've got. And hello to everybody that's on here today. I'm seeing lots of friends from Facebook and TikTok in YouTube. So hello, everyone. All right, let's see what we got. I'm starting to see some answers come in. So let's see. Good job, you guys. I'm seeing a lot of right answers already. So, oh, they're going too fast. I can't even read them. Okay, so we have Michelle on TikTok. Good job. I'm seeing Farah on Facebook. Definitely good work on your answers. You guys are doing good. Awesome. All right. Okay, so I'm going to go ahead and start walking through this. So you guys keep putting your answers in the chat. We'll talk about the question first, so I won't have any spoiler alerts about the answer for a few minutes. But okay, so starting with the question, we know the whole purpose of wound irrigation is to clean the wound, and it's all about infection prevention. So let's keep that in mind. We're talking about cleaning the wound and preventing infection. So those are kind of the basics we need to keep in mind. So that's step one. And then also anything supportive that would go along with that too. So next, our question is going to be asking about the actions the nurse should take. So anything that would be appropriate to clean a wound is what we're going to focus on. So knowing this, let's check our answers. We'll go one by one on the lines and see what we've got. So option one, review the client's vaccination record. So this is a true statement and an appropriate action to take. So when we look at it just by itself, review the client's vaccination record, we definitely want to do this. This is a true statement. So the nurse should review the client's vaccination record, specifically looking at when their tetanus vaccination had been administered. So typically tetanus is given, it'll be given in a case of a laceration if the client hasn't received one in at least 5 to 10 years. So we want to see that because we want to give that tetanus vaccination to help prevent infection. Again, relating it all about to the basics of what we're trying to accomplish. So infection prevention. So that is a true statement. It's a correct option. Let's go on to option two. Obtain a 10 milliliter syringe and a 27 gauge needle. So this is a false statement or an inappropriate action to take. So the use of a 10 milliliter syringe with a 27 gauge needle, that 10 milliliter syringe is really tiny. It's not really going to offer us a lot of continuous pressure when we are irrigating the wound. And that 27 gauge needle is really narrow. We want to use something that's wider because if we're pushing that fluid out, it's going to come out like way too fast and it can cause a lot of pain. So we want to use something that has a bigger volume and a wider needle. So something like a 30 to 60 milliliter syringe would be good, and then anything like an 18 or 19 gauge needle would work too. So that's an incorrect option. So far we have option one is correct, option two is incorrect. Let's see what option three says. Administer analgesics 30 minutes before irrigating the wound. So this is a true statement and it's an appropriate action to take. So this is going to be a correct option. So we definitely want to help minimize any of the pain that wound irrigation can take, but we have to make sure and plan ahead. So we want to give medication in advance of doing this, at least 30 to 60 minutes, depending on like oral or IV medication. So that's a true statement. Okay, so we have 1 and 3. So let's see what option 4 says. Cleanse the wound from the most contaminated to the least. Oh, I'm sorry, I think I read that backwards. Most contaminated to the least contaminated area. Okay, so we want to, the wound should be cleansed from the least to the most. So you don't want to introduce contamination from back into the clean areas. So we want to go from the most to the least. So again, this goes against infection prevention. It's not an appropriate action. So we have option 5, use continuous pressure and flush the wound and repeat until drainage is clear. So this is a true statement, and it's an appropriate action to take. So we don't want to flush the wound bed like in a pulsing action. We want to continuously flush that wound. So for this one, our correct answers are 1, 3, and 5. So you guys did really good. I saw a lot of those answers in our chat, so good job. All right, so let's see. We're going to move on to another one. We'll pull up our second question here. Very good, guys. Okay, I think we're good. All right. So the question says, the nurse is planning care for a 3-year-old client who has pertussis. Which of the following interventions should the nurse include in the client's plan of care? Select all that apply. So I'll read the options and then I'll let you guys answer in the chat. Option 1, implement droplet precautions for the client. Option 2, offer the client small sips of fluids frequently. Option 3, monitor the client for signs of airway obstruction. Option 4, request a prescription for a cough suppressant for the client. And then option 5, place the client in a room with monitored negative air pressure. So I'll let you guys take a minute to answer, see what we got. So it's a SATA. This is question 2 of 4. And we will let you guys answer and then we will come back to it. So let's see what you guys got. I'm seeing Stephanie. Good job. Erin, well done. This is great. You guys are doing good. Lucienne, good work. Very good, you guys. The chat is going so fast. Way to go. TikTok, I'm seeing a lot of 1, 2, 3s come in. Good job, you guys. Okay. Keep on putting those answers in. That's awesome. And we'll go ahead and start walking through. Okay. Okay, so kind of talking back, taking that same approach as we had before, we're going to start with the questions. So we are talking about pertussis, so we need to know about that. So we'll talk a little bit about that, and then knowing what we know about pertussis, we'll apply it to our option choices. So I know pertussis is also known as whooping cough. It's super contagious, so it's spread through contact and coughing and sneezing. So we need to think about droplet precautions. And how I always remembered or like kind of pictured droplet precautions in my head, anything that like you think about coughing and sneezing, anything that can like shoot anything out of your mouth that you can see, that would be droplet. And then when you think about airborne, it's almost just like breathing. Like we can't see the bacteria coming in and out, but for droplet, you can kind of picture it a little bit different than airborne that way. Okay, and then we also know this is in our respiratory tract. So anytime we think about respiratory, we need to think about breathing and airway. So those are going to be some of the things we kind of keep in the back of our head. Okay, so next our question is asking about a plan of care. So we need to think about interventions that we would do for pertussis. So again, I'm thinking about infection prevention, but not so much for the client themselves, but how can we protect others from the infection that they're carrying. We're also going to think about airway since we know pertussis is in the respiratory tract. And then we're going to think about supportive measures because it's not going to resolve immediately. We know it can be treated with some medication, but it also has to run its course. So we want to think about other things we can do to support the client while the infection is going away. So, all right, so that's kind of what we need to know. And then again, we will kind of apply this to our answers and go through them one by one. So option 1, implement droplet precautions for the client. So this is a true statement we just talked about. That's what we need to do with pertussis. It's spread through coughing and sneezing. So we want to be sure we're implementing those precautions so we're not transmitting it to anyone else, especially in an acute care setting. Droplet precautions is appropriate for pertussis. It's a true statement. So pertussis is caused by the bacteria Bordetella pertussis. And again, that's spread through human contact like coughing and sneezing. So droplet precautions include putting on a surgical mask, having the client be in a private room, and then putting on things like a gloves, gown, and like a face shield if you're worried about any transmission of like bodily fluid or any splash that can happen. Okay, so option 2, offer the client small sips of fluids frequently. This is a true statement and an appropriate intervention to perform. So again, treatment for pertussis is going to consist of antibiotics to address that bacteria. But again, we talked about this. It's also going to include some supportive measures like humidified oxygen and fluid replacement. So again, small sips of fluid is going to help loosen mucus so that the client can spit it out or cough it out. So we definitely want to encourage this. And we don't want to encourage the client to take a lot, and that might cause some aspiration of fluid. And so we want to just use small, easy sips, especially because this client's a child as well. Okay, so we have option 1, Correct. Option 2, true statement. Let's see what option 3 says. Monitor the client for signs of airway obstruction. So again, we talked about this. It just so happens our correct answers are the first 3 we cover, so it fits in nicely. But again, this is a true statement and it's an appropriate intervention to perform. So when the pertussis bacteria attach to the cilia in our respiratory tract, it's going to cause inflammation, and it's also going to cause like some swelling and irritation. So anytime we think about airway swelling, we're going to worry about airway obstruction. So that's why this is a correct answer. It's also, pertussis is also characterized by like this violent kind of spasmodic cough as well. So we worry about getting enough air in when this is happening. And the cough can also produce a lot of like a thick mucus as well. So any of these things all together, we're worried about compromise to our airway. So we want to make sure that we are monitoring them for signs of airway obstruction. This could look like anything like cyanosis or changes in respiratory rate, anything that looks like not enough oxygen. So that is a correct answer. So we have 1, 2, and 3 as correct options. Let's see what option 4 says. Request a prescription for a cough suppressant. So this is a false statement and an inappropriate intervention to perform. So cough suppressants really interfere with the kind of the act of expectorating the mucus. So we don't want to suppress that cough reflex. We really want to allow a cough to do what it's designed to do, which is to try and clear our airway. So this would not be an appropriate thing we should do. Option 5 is place the client in a room with monitored negative air pressure. So this is a false statement, and I would say this is probably like a close distractor that some of you might think would be a correct answer, but it's not necessary. So we don't want to read into this. We know that a client that's on droplet precautions needs their own room, but they don't need a negative pressure room. Negative pressure is reserved for things like tuberculosis, like TB, anything that is an airborne precaution. So you can think of airborne precautions as like MTV, the mnemonic. It would be like measles, tuberculosis, and varicella zoster. So it's just not what you need to do for droplet precautions. So again, don't overthink it. Just know that's not what is required for pertussis. So again, that is an incorrect option. And so our correct answers again are 1, 2, and 3. All right, halfway there. We've done 2 questions. We have 2 left. So we'll pull up our 3rd question and go from there. And make sure we're kind of at our halfway point. Make sure you guys are sharing this with your friends. We hope that we can get more on. We still have 2 questions left to do. So especially if you're on TikTok, let your friends know that this is happening and share it. And we still have time to do some more learning about SATA questions. All right, so we have our 3rd question pulled up. I'll go ahead and read it, and then we'll give you guys some time to answer again. So the nurse in the emergency department is caring for a client with type 1 diabetes mellitus who is reporting abdominal pain. The client has deep respirations of 36 per minute, a fruity odor to the breath, and appears lethargic. Which of the following actions should the nurse take? Select all that apply. So we have option 1, initiate an IV infusion of regular insulin. Option 2, instruct the client to breathe into a paper bag. Option 3, check the client's capillary blood glucose level. Option 4, place the client on continuous cardiac monitoring. And option 5, administer a 1-liter IV bolus of 0.9% sodium chloride or normal saline. So I'll let you guys take some time to answer. Okay, you guys are definitely into this. I'm seeing some people comment. Aaron commenting about diabetic ketoacidosis. That is definitely what we're about to talk about. So let's see what you guys come up with. I'm seeing a lot of correct answers. Let's see. We have... Oh, you guys are too fast. My eyes can't zero in fast enough. Stephanie, good job. Francis, good job. Sia, good job. Alfred, awesome. Thanks to everybody who's sharing us. I hope you guys keep doing that. Good job, you guys. They're flying in so fast. I think I need glasses for this now. So you guys are doing awesome. Good job. All right, well, a lot of you are kind of keyed into what we're going to talk about. So we'll kind of dive into the question again. So starting with the question, we need to put these findings together and see like what exactly the disease process is that we need to know about. So first things first, we see emergency department. So we need to think something acute, like kind of like the big implication of a disease process. But now we need to figure out like what this disease process is. So we saw type 1 diabetes. So thinking emergent situations of type 1 diabetes, I'm definitely thinking diabetic ketoacidosis or DKA. So I know that DKA is a life-threatening illness that results from a lack of insulin in our blood, and in return that causes extremely high serum blood glucose levels. So how our body tries to compensate for that is really what these manifestations show up as. So polyuria would be one of those. So our body's trying to flush out the glucose. So we're going to worry about having decreased fluid volume. We're also going to have electrolyte imbalances. So from our body being dehydrated, that's one thing that's going to cause that. But then we're also, that lack of insulin is going to mean we're going to have a lot of circulating potassium. So we talked, I think it was last week, about electrolytes and specifically potassium. And so we learned that insulin, not only does it take glucose into the cell, but it also takes potassium with us. So if we don't have insulin in our bloodstream, we're going to have a hard time getting potassium into the blood. And when we have potassium in the blood, we worry about changes, dysrhythmias to our heart, especially those fatal ones. So when we kind of put this all together, we're going to also be in a state of metabolic acidosis. So there's a lot of big things happening with DKA. And so those are kind of the pieces we're looking to put together. But big picture, our client is at risk for metabolic acidosis, life-threatening hypovolemic shock from all that fluid leaving our body, and cardiac dysrhythmias from that imbalance of potassium. So we also have, they mention abdominal pain, fruity breath, and increased respirations, and we'll talk through those when we kind of go into our option choices. But I do know that especially that fruity breath, that is definitely a sign of DKA. So putting these pieces together, using our context clues, I'm thinking DKA, so I need to have that in my mind when I'm looking at these option choices. So next, our question is asking what actions the nurse should take. So we need to think about emergent actions for DKA. So things that you need to do in the immediate setting whenever you're presented with DKA. So I know the basics are going to be fluid resuscitation, insulin administration, and monitoring for all things that are involved in DKA. So I'm going to think potassium, I'm going to think our glucose. I'm going to want to make sure we have baseline information, and then that we're doing consistent monitoring as we begin treatment to know if it's been effective. Okay, and then especially monitoring like the heart. We talked about that with potassium. Okay, so knowing this, let's check the answers and we'll go one by one and see what we think. So option 1 is initiate an IV infusion of regular insulin. So this is a true statement and it's an appropriate action. So again, we know that DKA happens from a lack of insulin, and we know that regular insulin is the only insulin we can give IV. So we've like double checked everything in this option choice is correct, so it's going to be a correct option. So option 1 gets a check mark, green light, good to go. Okay, option 2, instruct the client to breathe into a paper bag. So this is a false statement and it's a wrong action to take. So this is kind of relating back to the stem when it was talking about those Kussmaul's respirations. Kussmaul's respirations are deep, rapid breaths that have a fruity smell because of the CO2 that's being exhaled. So those respirations are kind of like a compensatory mechanism to lower our partial CO2 in our blood and combat that metabolic acidosis. So we don't want the client to breathe in more CO2, so we definitely don't want them breathing into a bag, because that's the purpose of breathing into a bag, is to rebreathe that CO2. We do not want that to happen, so this is a wrong answer. Okay, option 3, check the client's capillary blood glucose. Definitely can't go wrong with that, especially if we're assuming DKA. When we check that glucose, it's going to be extremely high, but we have to know what the level is to know how we can treat it. So this is correct on like so many levels. We need it to confirm DKA, but we also need it to monitor for progress in our treatment as well. So we have to do it for baseline information, and then especially this client's going to be on an insulin drip, so we need to be checking it as well. We don't want our client to go from hyperglycemic to hypoglycemic. Okay, option 4. So option 1 correct, Option 2, not correct. Option 3, correct. Let's see what we have for option 4. Place the client on continuous cardiac monitoring. We talked about this before. These clients are going to have elevated potassium. We know elevated potassium can be really bad for our heart. It's going to cause some dysrhythmias. So when we have high potassium, we're going to have those peak T waves, and eventually that can lead to fatal dysrhythmias like asystole. So again, we need to have them on there. We need to have a visualization of the kind of electricity happening in our heart, and we need to make sure that we're not progressing into kind of fatal dysrhythmias. So that is a correct option. And then option 5 is administer a 1 liter administer a 1 liter IV bolus of 0.9% sodium chloride, or we're going to bolus them with normal saline, essentially is what this is saying. And that is a true statement. It's a correct option. It's an appropriate action to take. So fluid resuscitation is like the #1 priority when treating DKA. We need to restore that fluid volume. We need to protect our kidneys, and we need to prevent hypovolemic shock. So this is really that foundation of what we do when we treat DKA. We have to restore that fluid. So this is definitely true, and it is a priority action too. So again, we're talking in the emergency department. We are going to start the client on, we're going to bolus fluids, and then we're going to transition them to maintenance fluids. But the first thing we have to do is bolus them and get that fluid volume back up. So our correct options are 1, 3, 4, and 5. So you guys, I think I saw like almost everybody had those right, and that was a lot of correct options. So good job. That is our third question. We have one more, and this is a very special question. We're going to pull it up, and you'll see why, and especially when we walk through it as well. So I will read it and give you guys a minute to answer. I'll check the chat, and then we'll walk through it. And this will be our last one for today. So the nurse is talking with a staff member about obtaining a wound specimen for culture and sensitivity. Which of the following statements by the nurse would require follow-up? Select all that apply. Option 1, cleanse the wound by gently flushing it with normal saline. Swab the wound from the outermost margin to the center. Option 3, apply bacitracin ointment to the wound after collecting the specimen. Option 4, perform hand hygiene and apply new gloves before obtaining the specimen. And option 5, obtain the specimen from the drainage accumulated since the last dressing change. So let's see what we got. Feel free to put your answers in the chat. And again, this is saying would require follow-up. So we're going to think about this one a little bit differently when we read through it. All right, let's see what we got. Erin, good job. Let's see, Shay, good job. Zoe, good job. Oh, it's happening fast again. Lily, good job. To say it really fast. You guys are doing great. Seen a lot of right answers. Good job. Lydia, good job. Tanya, good job. You guys are doing so good. Awesome. TikTok, I've seen a lot of right answers come through. And YouTube. All right, you guys are doing great. Farah on YouTube, good work. Okay, I think you guys are onto something here. Very good. Okay, so we will go ahead and walk through this one. So again, this one is special. It's a negatively phrased question. So we need to think about it opposite. So we're looking for those false statements if you were to read them as a standalone, or those incorrect statements. So anything that is not accurate is our correct answer. So let's kind of take that approach. Starting with the question, we're talking again about steps for obtaining a wound culture. So we kind of talked about wounds a little bit in our first question, but we're going to be thinking about this is how we're going to collect a specimen from a wound. So we're going to think about clean procedures, sterile procedures, things like washing our hands, gloves, the correct order and steps of things. So, and also having the right supplies. But again, our question is asking what statements by the nurse require follow-up. So our correct answers, again, are going to be incorrect statements or wrong actions to take. So we're going to ask ourselves this every single time we read an option so we don't get confused and we don't lose track, because it's so easy to be like, oh, that's the right thing you do, that's the right answer, but that's not what the question is asking. So that's why you have to really take this kind of one step at a time, bite-sized chunks. So knowing this, let's kind of walk through and see how our answers line up. So option 1 says clean the wound gently by flushing it with normal saline. So again, this is a true statement or something we should do, so it does not make it a right answer. It's an incorrect option. So option 1 is incorrect because it is an appropriate action to take. Again, we're looking for actions that require follow-up. So option 2, swab the wound from the outermost margin to the center. So we know this is not appropriate to do when we're obtaining a culture. So this is a wrong action, so it's going to be a correct option. So this does require follow-up. So we discussed kind of in our first question about this, but essentially we don't want to incorporate any skin into our collection, and we always want to go from the most contaminated out to the least contaminated when we're collecting a specimen. Okay, option 3, apply bacitracin ointment to the wound after collecting the specimen. So this is a true statement, and it's an appropriate action to take, and it does not require any follow-up, so it's not going to be a correct answer. So again, we're not going to select option 3. We do this, we'll do it after obtaining cultures to prevent interference with like microorganisms we might find on the skin. So again, it's the same kind of principle about why we don't give antibiotics before collecting blood cultures. It's the same thing here. We don't want to treat anything before we can identify what the microorganism is that's causing the infection. Option 4, perform hand hygiene and apply new gloves before obtaining the specimen. So again, this is a true statement, and it's an appropriate action and does not require follow-up, so it's not a correct answer or correct option. So we want to put on fresh gloves to obtain the specimen so there's no contamination. So again, this is what you should do, so it's not a correct answer. Okay, option 5, obtain the specimen from the drainage accumulated since the last dressing change. This is a wrong action, so it's going to be a correct option. So this does require follow-up. So pooled purulent exudate is likely contains that skin that can kind of interfere with our results. So we do not want to collect the specimen from there. We want to collect it from the wound bed itself. So that makes our correct answers, option 2 and option 5. So you guys, a lot of you guys got that. You did a really good job. I hope this was helpful just to walk through different types of questions that we have, how to approach the questions, how to think through it, and just get some good practice in as well. So that's all we have for you guys today. Thank you so much. Make sure you go to nursing.uworld.com to try out our 7-day free trial. You'll see a lot of questions similar to this, our case studies as well. We have a ton of great resources on our website, so check us out. Make sure you come back next week, Tuesday and Thursday at noon. You can, again, find us on demand, and we make sure, as always, subscribe and follow UWorld Nursing on your favorite channels so you can get updates about what's coming out, and we have a lot of great resources for you guys. So best of luck and see you next time. Thanks again. Bye.